Good afternoon, everyone. Good afternoon, everyone. So, my next topic of the video, which I'm going to discuss with you, is on the topic beta blockers in congestive heart failure. And before I start my video, I want to request you, if this video is useful to you and if it is helpful to you, kindly subscribe to my YouTube channel, Dr. Nitika Pharmacology Discussion. And now I'm going to discuss with you beta blockers in congestive heart failure. Now, the use of beta blockers is controversial in the heart failure. It leads to myocardial dysfunction because it decreases the heart rate, so it decreases the stroke volume and it decreases the cardiac output. But in heart failure, we need to increase the cardiac contractility, but this decreases the heart rate and it decreases the stroke volume and decreases the cardiac output. So beta blockers, basically, these are contraindicated. Unexpected mortality benefit was observed with beta blockers. Means mortality benefit was observed with the beta blockers, which was unexpected. Now, exact mechanism of action in heart failure is not clear, but it decreases the cardiac output initially, followed by normalization of cardiac output and then increase in cardiac output within 1 to 4 months. Means first it decreases, then it normalizes, then it increases within 1 to 4 months. Caution is we have to start with very low dose, gradual increase in dose over a week. Limited experience in patients with new onset and recently decompensated heart failure. Yes, in the new onset, it is in the acute heart failure, and in the decompensated heart failure, this drug is not given because in acute heart failure and in new onset heart failure, it will lead to decrease in the heart rate, and that will lead to decrease in the stroke volume and decrease in the cardiac output. In decompensated also, the cardiac functions are not restored, so this also decreases the cardiac output. Now, beta blockers, what are the clinical effects? They improve symptoms. Now, it improves the symptoms, but only on the long-term use. I've already told you. First, it decreases, that it normalizes, that it increases the cardiac output. So, it improves the symptoms, but only on the long-term use. And it also reduces the cardiac remodeling, hypertrophy, fibrosis, inflammatory changes are reduced by the beta blockers, and they reduce the hospitalization, they reduce the sudden death, and they improve the survival. And they also inhibit the release of the renin from the juxtagranular cells. So they lead to decreased production of the angiotensin 2 and decreased release of the aldosterone. So when angiotensin 2 is not produced, so vasoconstriction will not be there and aldosterone release will be inhibited. So sodium and water retention will also be reduced. Sodium and water tension will be reduced. So that will lead to decrease in the afterload plus decrease in the preload. Now, what are the indications in symptomatic heart failure? When the symptoms are there in the heart failure, so in symptomatic heart failure, we give the beta blockers. In asymptomatic ventricular dysfunction with left ventricular ejection fraction less than 35 to 40%, and after acute MI, myocardial infarction, we can give the beta blockers. Contraindication in asthma. Asthma is because they cause the bronchoconstriction, because they beta blockers, when they block the beta 2 receptors, they will cause the bronchoconstriction. So these are contraindicated in asthma. AV block, because in AV block already the heart rate has been reduced, so that will lead to cardiac arrest. Symptomatic hypotension, any hypotension also, or in bradycardia when heart rate is reduced, so we need not give the beta blockers, and diabetes is not the contraindication. Thank you. That's all with beta blockers in heart failure. I hope you like this video. And if you like this video, kindly subscribe to my YouTube channel. This is Dr. Nitika Pharmacology Discussion. Thank you. Be happy, be healthy, be blessed. Happy learning. Thank you. Stay blessed. Okay.